3. Open up.
Welcome back. Thank you so much for keeping it locked. It's going to be one of those very special days. I know this because I got to stare into the eyes of a very special little girl this morning. And before we introduce you, though, let's give a bit of context. World Birth Defects Day takes place annually on the 3rd of March, recognizing all birth defects as we term them. It aims to raise awareness of the causes of birth defects and the impact around the world, because there is a massive ripple effect. So let's put it in context again. In Southern Africa, around 11,000 children are born with clubfoot every year. And if it is left untreated, many children will then have congenital defects. They are forced to live a life of essentially disability. And here to chat more about this topic is Gabrielle Rademacher, who is the coordinator at STEPS. And then Carleen Minnie, who's brought along a little seed stealer, Madison, currently being treated for clubfoot.
Good morning.
Good morning. Welcome. Thank you so much for joining us.
Can we just acknowledge, first and foremost, the cuteness of little Madison? She is adorable. You said she's 8 months old now.
Yeah.
And the posture's fantastic. Well done, Mom.
She's owning her space this morning, that is for sure. Gabrielle, let's start talking about this. What exactly, clubfoot, when we speak about clubfoot, what exactly is it, and why is it detrimental if left untreated for a young baby?
So clubfoot is a condition that's present at birth. Here, I have an example for you.
Okay.
Where the foot is twisted inwards at the ankle and pointed downwards. And the tendons will be very stiff and tight, and the foot's very rigid.
Okay.
So that's a clubfoot.
What drives that? Is it the tendons itself? Is it something with the mechanism of that muscle and tendon function? Is it the structure of the bone? What is actually going on to lead to the structure?
So it's a tightening of the tissue within the ankle. They don't know all that much about why and how it happens, because it just happens. You can't really prevent it. And then it can also sometimes be the position that the baby's
was in the womb,
in the womb, but then it's slightly different. Then the structure on the inside isn't. The structure on the inside of the foot isn't different. It's just because it's been held in that
held
position.
Like that, and obviously that's how the tendons then kind of formed and shortened, I suppose.
So that would be a positional clubfoot, much easier to treat. It sort of just goes quite quickly, whereas the congenital one, where there's a genetic defect, so to speak, within the foot, it's more difficult to correct.
Sure.
This word terrifies me. Defective. I will slap you across your face. You call my baby defective in any way.
Yeah, I think the thing to remember is it's not a death sentence. You know, it can be treated.
What has your experience been like with young Madison going through a process like this?
Well, I think obviously for every parent it is traumatic and it's a challenge, but it's been good, and obviously we've got the wonderful people at STEPS helping us, and you know, we keep going to all our doctor's appointments, and every day and every week just gets closer and closer to, you know, that time which will be completely won't have any
be free of it. I suppose the danger here is because she's going through such a critical developmental phase. We joke about posture and those sorts of things. You are already terrified as a parent that you're not doing everything, that you're missing a milestone, that you haven't got it right, that your genes are going to weigh in this. How did you go through that mental transition? Because you're giving such a beautiful, calm energy right now, which I know comes with the mommying. Yes, you're also giving a beautiful energy right now, not quite so calm, Madison.
Damn,
all right, I know it's all on you. I know that you're the one driving this, but as a parent, especially going through this phase, how did you wrap your head around it? Did you have to have that talk with yourself? Did someone else have to have that talk with you? How did you galvanize yourself into this positive mindset?
Yeah, so I think a lot of it is having your support system around and be knowledgeable, reading up, and you know, seeing how, like I said, it doesn't have to be a bad thing. You know, it can, with all this treatment that they're getting, they won't be disabled. And I think just focusing on the long term than the short term.
There's so much more than this condition. So much more.
Yeah.
We're going to get to what STEPS are doing in just a moment. You guys are not going to go anywhere. How is little Madison today? Is she doing well? Is she moving about like a baby should?
Look at these beautiful feet.
Look at those beautiful feet. You can't,
You won't even know.
How severe was the clubfoot with Maddie?
But hers, yeah, she has,
Really?
yeah, she was completely, her foot was completely turned in like that on one side. So, yeah, and she's on the maintenance phase now. So she's gone through all the casting and so on, and now we're on just what they call the boots in a bar.
She keeps looking at all of us like, y'all trying to steal the credit for my wonderful story. There is one real little hero in the works here, and I love the fact that this in no way seems to be slowing her down or affecting that beautiful nature. So well done to you for getting to this point. That in itself is hope enough that there is treatment, there is a community of people waiting to help you. We're going to continue to discuss clubfoot specifically as it relates to young children. If you've got any insights, please let us know. 0634088863. We'd love to hear from you.
Absolutely love the conversation. Looks like Maddie's wide awake, ready for it, and everybody else is. And that means it's time for you this morning to get up off the couch or out of bed and move those beautiful bodies you've been blessed with. Yes, and we've got an incredible workout happening for you this morning, right? We're talking about chairs, which have gotten a bad rep lately, but too much sitting and not enough moving is what it's causing. So chair workouts are for so many people. If you're recovering from an injury,
Welcome back to your Feel Good Breakfast Show Expresso right here on S3. Now we are continuing our discussion around clubfoot with Gabrielle Rademacher, who is a coordinator at STEPS, and Colleen Minnie, whose daughter Madison is currently being treated for clubfoot. Now, it is so common in Southern and East Africa that the inaugural Clubfoot Africa Conference held in November 2022 attracted virtual and physical attendees from 43 countries, all congregating to discuss the latest techniques, knowledge, and solutions available to treat clubfoot.
Yep, and you're getting your cheerleading in. Madison is congratulating everyone who came through. Thank you so much. You're all amazing. Yay. Oh, she just clocked herself on TV for the first time. We know what you're going to do when you grow up.
Yeah.
And she, of course, is free to do what she wants to do when she grows up, because clearly her treatment is working. Gabrielle, maybe talk us through some of those treatment options. Let's get practical here. What is the process that we follow, and what do you look at when approaching a case? Because every baby is an individual little thing. How do you start treatment, and what do you look at?
So the treatment that's the gold standard now in South Africa is the treatment we advocate, and it's the Ponseti method.
Ponseti.
So the old way of fixing it, which is still used in some countries, is surgery.
Okay.
And where the doctor will, it has to be an orthopedic surgeon, will cut open the foot, sort of realign the bones and joints, lengthen the tendons. But this is not the best solution, because it can often
we're talking about a baby here, and that's super invasive.
Exactly.
Yeah.
And the scar tissue, it often leads to more surgeries needed, a lot of pain. So the Ponseti method is a soft and gentle manipulation. So when you start out with the foot like this, there's a soft manipulation by the doctor, and then there's a series of weekly casts. So each week the foot's then held
slowly.
Exactly. It's a slow movement, and after about 6 to 8 casts, the foot is then in the correct position. So the earlier we start, the better. How old was Madison when she started?
3 weeks old.
3 weeks old.
Wow, so you get
babies
started.
just they're soft.
I guess you know the earlier you start, the better. But generally, I know that every baby is different, and every condition, and severity is different. But how long is this process typically?
So if you start early enough, it can be 6 to 8 weeks. And it also depends on how experienced the doctors are. So in South Africa, we've been running the Ponseti method for years. So our doctors are very experienced.
Some of the best in the world, if I understand it.
Exactly. Especially in the main clinics. A lot of rural clinics, and that's where we'll go and train. But, most of our doctors at the main clinics are very proficient in Ponseti. And then once you get to the corrected position, in 80% of cases, the last little bit is you need to lengthen the heel cord, because the heel is up. So the Achilles tendon.
These are very strong.
Yeah, and they're very tight. So they'll clip it. Did Madison have a tenotomy?
Yes, she did.
So they'll clip it, and what's amazing about children is it'll regenerate in 3 weeks.
Oh, for sure.
When we pop our Achilles tendon, how long does it take?
Baby cells. We love baby cells. We absolutely love that. I'm just thinking from my own parenting perspective, being able to do something must be such a powerful tool in the beginning, to be able to start treatment that early. How much of a shift in the way that you approach parenting have you had to structure around this and the treatment? How have you put it in perspective? What is day-to-day? Maybe that's a good way to approach it. Look like for you guys through this treatment process. What's that been like?
So I think a day-to-day, it all depends on each stage of the treatment is different, because in the beginning you would have the casting, so you'll be like no baths and, you know, that type of thing, obviously trying to get clothes that fit around the cast. And then obviously then she goes onto the boots and bars, which is those little shoes, and it's got a bar in between that they will wear, and to maintain the feet then in that correct position. And again, I think it's just the mobility of trying to carry the kid and put them somewhere. But yeah, it's somebody who I was fortunate enough to have somebody I know whose child also had clubfoot, and the way she gave me such perspective in the sense that you would be a worse parent if you didn't correct it. Yeah. Because in the long term, they would have the disability and the pain. But, you know, because in the beginning you feel, you know, it's awful having... You're putting them
and I'm sure just having the options of help available through, you know, organizations like STEPS, you know, puts a mom at ease. You know, when you hold that newborn baby, I mean, you want everything to be perfect. You want everything to be just absolutely moonshine and roses. But then you're faced with a condition, and knowing that it can be solved and it can be fixed, I mean, it must be a huge relief for you as well.
Yes, exactly. Knowing that, I mean, should be able to have a normal life like any other children, running around and wearing proper shoes and, you know, that mobility for itself.
And maybe with a little extra metal, because she's had to face the challenge from the very first.
This is what we find with these kids, is the poor parents. It's much harder on the parents than hugely. And you wouldn't think it now, but Madison is currently in treatment. So now the feet are straight and she's just wearing the brace at night. So you're obviously very good at it, you know, with kids. You let them get away with something once and you pay for it.
Well, yeah, sorry to interrupt. That's exactly what, like Gabby says, keep persisting. Keep just push through it. It's not nice, but because at the end of the day, it pays off, you know.
Well, clearly, we're looking at a beautiful little girl who is ready to rock. You know, help us all when she does start running around. Absolutely beautiful. It does bring to bear the need to connect and create and empower the community in this space. We're going to continue to do that with the rest of this discussion. But first, I need something to eat, buddy. Can you go cook for me?
I'll grab you something, my man.
Fueled by Madison's energy right now, it's time to step into the kitchen for a healthy 5-ingredient recipe that's bursting with delicious flavor. Bring it on!
Clover No Lac, lactose-free milk that lets you enjoy dairy again. Made with love by Clover.
Oh, yes, we're making it with love, of course, and this recipe has to be one of the easiest ones out there. It's just 5...
I hope I've made you proud.
Welcome back as we wrap up our discussion around clubfoot with Gabrielle Rademacher, who is a coordinator at STEPS and very kindly stepped in to educate us this morning, and Carleen Minnie, whose daughter, gorgeous little fierce Fortunator Madison, is currently being treated for clubfoot very successfully, we might add. And to give a bit of context, clubfoot is the most common musculoskeletal birth deformity and affects approximately 150,000 to 200,000 children every year, but there are treatments available. So thank you so much for guiding us through the first steps of that process.
Before we continue with the discussion, we received a picture from one of our viewers, Deirdre, who as a child had to wear these special boots. She's a mature young lady now, but she sent us this picture. If we can throw it up on the screen very quickly. There we have it, you see there. So what do you make of that? Thank you very much, Deirdre, for sharing. Appreciate it.
So that's the part of the treatment called the maintenance phase, which is what Madison is going through now. So the foot's been corrected, the heel cord has been lengthened. Now to maintain that position, the little ones have to wear a brace, but only when they sleep.
Yeah, only when.
And that's until you're about 4 or 5 years old.
I quickly got to ask, sorry, Graham, misconceptions around clubfoot. We see now those numbers are very high. So many babies are born with it. So many babies are affected with clubfoot. But what are some of the misconceptions, I think, in general, with people out there?
So we're always up against the stigma, especially here with the ancestors.
Yeah,
you know,
sure.
the mother either ate something wrong, drank something wrong, didn't conduct her life.
Well, a reason is attributed to it, for sure.
Yes, and, you know, the way we deal with that is just education as much as possible. Just educate. We have amazing educational resources. We've translated it into 6 different African languages.
Well done.
So we supply them to all the clinics. We work in 38 clinics in South Africa and Southern Africa, some in Namibia and Botswana as well. And we just educate as much as possible. And because we have people working in the clinics, they can take the parent aside and talk to them. Whereas in a low-resourced sort of clinic, you don't get one-on-one with the doctor.
Well, there's no relationship with the doctor, and I think we often underplay that because we just want to get awareness out there. We want to reach as many people as possible, but it does require selfless individuals going above and beyond. That's
some of these doctors
the
deal with
line.
90 patients a day.
Well, this is it.
How are they going to talk you through it? How to look after the calf, to make sure it isn't cracking, then to check this, then to check that, then to make sure the brace is on. They just don't get the time. So we take that burden off the state.
I absolutely love that, and I hope that this is connecting a strategic network and extending that network. And I'm going to ask you to think about what you need, and you're going to scream it into that camera just now in terms of fighting this battle. Exactly. I know. Don't give me the over-the-shoulder dragon, man. That's brilliant.
Colleen, I'm going to quickly ask, I mean, for you that's been going through this process, but, you know, you can obviously see how happy Maddie is at this stage. You know, what advice can you offer for moms out there that's potentially dealing with the same situation, not knowing where to go, who to turn to?
Yes, so I would say definitely reach out if you can. They're on social media, on Google. So build your support network. You know, it's good to get the family and friends involved, and you know everybody helps together. And read up. It's, you know, empower yourself. There's lots of just like Gabby said, there's lots of education out there. You know, knowledge to do that. And push through.
Push through, yeah. Well, that's one thing a mom is going to do, and a dad. I know we use that brush. We paint quite loosely.
Yeah.
I suppose the heartbreaking notion here is that this is something that can be addressed. And if we blanket this as a disability, we are already saying this is something that can't be transcended. But watching Maddie transcend this right now. In the most practical of senses right now, what do you guys need? What do you need from the rest of us? What do you need from your medical fraternity? How can we help?
Well, the obvious thing is always funds.
Funds. Money, please. Yeah.
So we've worked it out, and when children are visiting a state facility, it's only 2,500 Rand for the full 4 to 5 year treatment that's needed. That's all it costs. So we have a Backer Buddy campaign going where you can donate 60 Rand a month. It's a cup of coffee.
Sure. How about a company just steps up and does like 10,000? Like that is so ridiculous. This whole ecosystem is manageable. Yeah. It really is. Thank you so much. Well, all you really needed to do was bring Maddie along, but thank you so much for doing what you do every day. We really appreciate you.
And thanks to the moms and the kids and our doctors. Our doctors are amazing. They will train with us at no cost to themselves. They're always there to answer all the questions because we have created a network. That's exactly what we've done. Over the 38 clinics, we've created a network. The doctors from here will train the doctors from there. It really is amazing. And the conference really brought it all together. It was a pivotal moment in clubfoot.
Well, thank you very much for your incredible work and perseverance. And Colleen, to you and Madison, all the best.
We won't talk about your lower back yet. That's all the moms for next week. But please, if you do have a perspective or you can offer help, assistance, infrastructure, anything to aid this journey, please do 063-408-8863. Stay connected with us. We'd love to hear from you. We'd love to see pictures and videos. We want to see more gorgeousness like little Maddie. Thank you, guys. Thank you so much.
Yay! Honestly, I'm feeling so inspired by the conversation. Maddie is full of energy right now. You can hear behind me. But of course, we're sticking to that topic of health this morning. And let's turn our attention to what you've just heard now, those healthcare professionals that we are so grateful for. Now, pharmacists are not only brave, but they inspire hope within their community. Now, Pharmacy of the Week is a short feature acknowledging our incredible pharmacists. Now, this is our way to say thank you to these brave healthcare workers, proudly brought to you by Adcock Ingram, OTC, sponsors of